I'm Dr. Shankar. I'm a physician by training. I work with the TATA Trusts Nutrition Division. I'm the Director of Programs for Nutrition. At the outset, I would like to very clearly and emphatically mention India has the wherewithal and the means to really achieve SDG 2. Now, if you look at the different aspects of the question that you asked, I think food security is a household level concept. And if you say hunger, it's an individual level concept, though they are all related. And a chronic food insecurity is what leads to malnutrition. One of the causes, and there are several other things. And all this is in some way related to what the agricultural economy and the produce. So the question is, can we achieve SDG 2? I think definitely yes. And the way that the country is moving, I'm very confident that we will be able to eliminate hunger, and we have achieved quite a bit of food security at household level, and we should be able to substantially reduce the level of malnutrition. Yeah, when you take, I would like to face it as how do we tackle malnutrition? To tackle malnutrition, we need to understand there are different dimensions to it. One is when you eat much less than what you need and you result in what is called undernutrition. The other extreme is when you consume more than what is required, you end up with overweight and obesity. What straddles both this form of malnutrition is what is the vitamin and mineral deficiency, what we also known as micronutrient deficiency. There are three dimensions to malnutrition. One is undernutrition, the other is overnutrition, and what straddles both this form of malnutrition is what we call micronutrient deficiencies, or what is also known as vitamin and mineral deficiency. Each one of them require a separate strategy, though they are all at the implementation level, they are all related, and they will all be done in one way. See, vitamin and mineral deficiency is a very widely prevalent nutritional disease, and numerically probably this is the most widely prevalent nutritional disorder. An example is the prevalence of anemia in India and across South Asia. Now, there are different ways by which you can address this. The ideal would be for people to eat a balanced diet and eat right. But unfortunately, that is not possible because the food is either not available or affordable, as well as there are huge behavioral challenges in eating right. So the second way to tackle this at a national level is identify those who are deficient, or at least those in the high risk category like pregnant women or very young children, and give them the supplements of, say, iron folate supplement or zinc supplementation to what is required. But that is again cumbersome in the sense it requires a complete delivery channel, and you have to contact those who are deficient and provide it. And the third commonly used strategy is identifying the commonly eaten food and adding these vitamins, missing vitamins and minerals into the commonly eaten food. And this is what we call as food fortification. Food fortification has played a major and a significant role in virtual elimination of many nutritional disorders from the developed countries, such as in the whole of North America and Europe. Diseases like beriberi, vitamin rickets, goiter, they've all been virtually eliminated because of food fortification. Countries like India, this is one strategy which is grossly underutilized, and it is time that we use this for the benefit of the population. See, malnutrition is it's a very complex problem. There are multiple levels of causality. At the closest level, we talk about it's about what you eat and how healthy one is. You should eat right and eat right amount of food, and one should be in good health to digest or assimilate and use this food. This is at the most proximal level. There are two other levels where you talk about several other factors such as food security at a national level, food security at a household level, and then the ability to use the available food, the intra-household sharing. That is where comes about the intra-household dynamics, empowerment of women, literacy of women, and so many other factors. Then you have the environment that talks about the disease in the environment. It's water and sanitation, hygiene. These are other important issues. So it's a very complex and interrelated problem. As we can see in India, for the phenomenal progress that the country has made, in several fronts, malnutrition remains as a very big challenge. So it clearly shows we need multiple sectors to come together to play a role. And corporates or businesses are one of the important pillars of any economy. So they also should play the role that they can. Another important thing, the role that they can play is, if more and more, with the rapid urbanization that is happening, with more women getting into the workforce and more of the population getting into cash economy, they're all dependent on the market for their daily food needs. So the businesses that are in food and beverage business, they have a big role to play, as well as a very big responsibility to carry on their shoulders for the right nutrition and health of the population. So one is what direct role that these companies who are in food and beverages business can play, and then anyone in the business or anyone in the corporate sector can play a role by making, nutrition and health are fundamental drivers of growth. Unless you have healthy people, you will not have a healthy economy. So we must get all sectors of the society to be part of this fight against malnutrition. See, that's a very important question. I think it has also been one of the real missing pieces in our country. It has always been viewed as the responsibility of the government. I completely agree that the government has to be in the driver's seat to improve the population health, population nutrition. But a lot of nutrition occurs at home. At the individual level, at family level, at community level, people will have to take on that responsibility to improve their health and nutrition. You have built Anganwadi centers, but they are of use only if people go and utilize them. They often give that excuse that the delivery of services are poor, but only by increasing the utilization, taking ownership by the community of all these health and nutrition centers, that will only put pressure on the service delivery to improve service delivery. So I think that is important. And also a lot of nutrition has to happen at home. The decision of a mother to adopt and breastfeed the child, take the child and get the child immunized, and go and get the child attended to as and when the child has a medical illness or any health issues. All that requires a kind of a health-seeking behavior that would improve the health and nutrition of the child and the society as a whole. So the community participation and community's ownership, I would say, and taking the responsibility for health and nutrition would constitute a very important part for us to succeed in this fight against malnutrition. There have been some great successful examples. There are many examples across the country. Several NGOs have done. For example, I work with TATA Trust now, and we have a project called Making It Happen in Rajasthan and Andhra Pradesh and in Palghat district in Maharashtra. In these places where you work with the community, create that awareness, and also get the PRIs, the Panchayati Raj institutions and self-help group women's and adolescent girls, take the leadership and use the community health facility as well as the Anganwadi centers, the things improve remarkably. There are several examples of such successful models, but the problem is many of them are working either slowly or at very small scale. And the real issue is to take these models to scale and at speed. And for that, we need mass mobilization. And mass mobilization where the communities take the ownership and drive the agenda. With this India's growth story and all that has been written about that inequity, there are a section of the population who are very rich, and many of them are also setting up their own philanthropic foundations. And we also have a legal mandate for the corporates to donate or implement the corporate social responsibility, where a certain proportion of their profit for the social benefit. So we have a lot of resources coming. Quite a bit of it is going towards education and quite a bit to curative medicine. But somehow nutrition has not attracted these donors. And I think it is very important for the nutrition community to project to the philanthropists as well as the CSR resources that nutrition and health are foundational blocks for human development. And the link between optimum and nutrition at the right age, what we call as a critical window of opportunity, the first 1,000 days, that is from conception to the first 2 years of the child, is where most of the brain development occurs, and that is what determines how well the child is going to be, how much of the true genetic potential the child can reach. So investing in nutrition in early life or in the first 1,000 days is one of the foundational investments for a bright future of the country. So therefore the philanthropists and CSR funding should also focus on this if they want their later investment in education to really fructify. So I think it's a big role, and the nutrition community has to project this very well and draw in more resources for nutrition. I think it's fantastic, and I really appreciate the group that has come forward to do this. The media has generally played a role as a watchdog and has only been pointing out where there have been hunger, there have been hunger deaths, where there have been serious problems, and that has played its role, and that has really always had the whip in its hand and bitten those in slumber. But from the little that I know from this initiative, this is likely to be a comprehensive platform to bring all the stakeholders on board and give a lot of positive stories, because eventually it's only the positive stories from which people can learn how to expand and cover the entire country. So creating a platform for action by showing a lot of positive stories, keeping all the key stakeholders interested in it is, I think, a phenomenal initiative, and I wish all the success for it.